Republicans finally have a bill to repeal and replace Obamacare. I am holding it in my hand. It is a real bill, and it is stranger than I expected it to be. There is a lot more of Obamacare left in this bill than I think anybody expected. There are differences, of course, we'll get into those, but there's a lot of popular parts of Obamacare Republicans now keep. They are definitely working in an Obamacare world. Can continue on your parents' insurance until 26, that's still in there. Requiring insurers to cover pre-existing conditions, check, still in there. Preventing insurers from setting lifetime limits, check, still in there. Tax credits so people can afford healthcare, check, still in there. Covering the people on Medicaid today, it is in there. Now, I don't want to overstate this. There's a lot in the bill that changes. Huge tax cuts for rich people, for one thing. The tax subsidies, the way we help people afford insurance, that's going to be based on age, not income, and it's going to be a lot leaner. The Medicaid expansion that covers more than 10 million people now, if you read this, it stops adding new people in 2020. These details, they will change as the Senate and House argue over the bill. But for this plan to work at all, one thing Republicans have to figure out is how to bring healthy people into the system. And here's why. If you think of a group of people on a continuum, from the healthiest to the sickest people, they use the most healthcare, so they're the most expensive to insure. That's why to get a good mix of people, to get premiums down on average, you need a lot of healthy people signing up for insurance. They use less healthcare, so they pull premiums down for everyone. This is the core question of insurance markets, how to have enough healthy people to balance out your sick people. The reason this is difficult is that healthy people, they don't need insurance as badly. So when more sick people come on board and the prices come up, it is the healthy people who leave. Without them, the insurance gets even more expensive, which drives out the next group of healthy people, and so on until insurance is completely unaffordable. The way Obamacare tries to fix that problem is the individual mandate. Everyone has to either have insurance or they pay a small fine. The Republican plan replaces the individual mandate with a provision saying if you get sick and you need to rejoin the insurance pool, insurance companies can charge you a 30% premium. That's not going to work. Already, Obamacare's individual mandate is too weak to pull in as many healthy people as the law needed. That's why premiums have been rising in a lot of markets. This is weaker. It could lead to death spirals in a bunch of markets as healthy people flee and sick people are all that remain. And make no mistake, if they pass this bill, Republicans will own these death spirals. But that's just one problem in here. Look, hypocrisy is a minor sin in politics. People are hypocritical all the time, but it is remarkable how much hypocrisy there is to be found in this legislation. Remember when Mitch McConnell said this?
There are 25 million Americans who aren't covered now. If the idea behind Obamacare was to get everyone covered, that's one of the many failures. In addition to premiums going up, co-payments going up, deductibles going up.
So after years of Republicans complaining that co-pays and deductibles are too high in Obamacare and not enough people can afford insurance, this plan, the Republican plan, it lets insurers offer coverage with higher co-pays, higher deductibles, makes it harder for people to have it, to actually use it. And then not only do they make that insurance harder to use, they make it harder to afford in the first place, particularly for the poor. Under Obamacare, the government gives subsidies to poor people to help pay their premiums. The Republican plan, it replaces these subsidies with tax breaks based on age, not income. And without the income-based subsidies, a lot of people aren't going to be able to afford insurance. The credit rating agency Standard & Poor projects between 6 and 10 million people will lose their insurance under this bill. A lot more would suddenly find the coverage they can afford has huge deductibles and doesn't actually cover that much that can go wrong. The biggest problem this bill has, the more I read it, is that it's not clear why it exists, what it's trying to achieve, what it makes better. In reality, what I think we're seeing here is Republicans have lost sight of what they were trying to achieve in the first place. They are trying so desperately to come up with something that will allow them to say they've repealed and replaced Obamacare, that they've let repeal and replace become not just a political slogan, but a goal. This is Obamacare light. It's a worse version of Obamacare. And it's a lot of political pain to endure for a bill that won't just fail to improve many people's lives, but will badly hurt millions. Republicans need to really look at this and ask, what are they trying to achieve here? What is the point of all this?